Welcome to Local Doctors on Call. I'm Grant Boxleitner. Today we're discussing a traditional Chinese medicine approach to treating depression and anxiety. And I'm joined by Dr. Stephen Wrench and Dr. Courtney Connell of East West College of Natural Medicine. Welcome to the show, gentlemen. And in this segment, we're talking about depressive disorder. So I just want to start. What exactly is depressive disorder?
Well, depressive disorder might be defined as a prolonged low mood, a sense of sadness, a sense of despair.
The blues, perhaps?
Exactly. It would be a lack of interest in things that you once found enjoyable. It's hard to get.
Like exercise or hobbies, perhaps?
Certainly, things that you once found to be fun, you really have a lack of interest in. It also could manifest as changes in sleep patterns and a lack of appetite.
Dr. Connell, anything else that you want to add? Is that pretty much?
Well, when it does become severe, we really define it as when it interferes with your daily life, right? So these low moods, and maybe the oversleeping or not sleeping enough for the appetite. What ends up happening is that your daily work life or even your relationship with your family gets disturbed because of the depressive disorder, and then it really needs treatment.
So this can have a lot of repercussions if left untreated.
Well, yes, of course. It repercusses not only through the society, through the job, but also into the family, and then, of course, the own person's well-being and their enjoyment of life.
So how exactly common is this?
Actually, it's quite common. It's estimated that between 8 and 20% of the population of the United States suffers from anxiety and depression. Women, incidentally, being 2 to 3 times more likely to experience it.
And this often goes undiagnosed?
In about 50% of the cases where people have it, it goes untreated, which is a sad state of affairs, but it's often misdiagnosed, and it's also sometimes a psychiatrist will make a diagnosis, but a lot of times a medical doctor will listen to the patient and prescribe the medications for it, which is necessary, but they've never actually get an accurate diagnosis for it.
So potentially people could be living with this for years?
Absolutely. In fact, I'll tell you something that's interesting. If you were born after World War II, you are 10 times more likely to suffer depression than your parents. And here's another statistic that's a little unnerving. 4% of people diagnosed are between the ages of 11 and 17. Kind of sad.
And this can just come on. We don't really potentially know what causes it. I know it's a chemical imbalance and a lot of other factors at play, right?
Well, there's a lot of factors.
Well, the way Western medicine defines it is, yes, there is a neurotransmitter imbalance, they might say. Like not enough serotonin or not enough acetylcholine would be or GABA deficiency. These different neurotransmitters is how they would pinpoint a method of treatment. It is thought that it is these neurotransmitters that are actually causing the depression. You know, we as acupuncturists may think that there's a more dynamic relationship to the whole body, but as Western medicine defines it, it really is a neurotransmitter disease.
Yeah. If we might just say this too, it's the 4th leading cause of disability in the world, and it's expected, or projected rather, to be the 2nd leading cause by the year 2020.
So is there more than one kind of this disorder? Does it run in different?
There are 2 primary categories. And number 1 is major depressive disorder. You may hear it as MDD. And this involves an extended period of one or more periods of depression lasting approximately 2 weeks, plus the addition of other signs and symptoms of depression. And the second one being what's called dysthymic depressive disorder. And this is an episode that's lasting at least 2 years, plus the additional symptoms of depression.
Now, is one more severe than the other? It sounds like the 2-year one could be potentially more alarming.
It's actually considered lesser.
Less?
It is the major depressive disorder.
And so if they come to the college, you will find out potentially which one they fall into based on a...
Well, you know, in our medicine, and you may want to handle this, but we don't diagnose in exactly the same way, of course, that a Western MD would. And I'd like Dr. Connell to elaborate on that if he would.
Sure.
Right, because in our medicine, we don't just diagnose depression. We see a compendium of symptoms, and we give it what's called a differentiation. So we can have one disease, depression, or anxiety, one or the other, and it can have multiple reasons that it's come about in your life. We call this the differentiation. So when we look at someone and they come in with a diagnosis from a doctor with depression, we go, this depression could be due to deficiency of, maybe it's food, right? It could be due to
Nutrition or
right. Nutrition's probably why so many young people, because of the change in diets. That's more than likely part of the cause. But it also not only deficiency, but we could have another situation where there's stagnation, right? And the flow of the nutrition and the energy of the body gets stuck, and this can also cause depression. So when we look at disease, we do look at these multiple causes. So when they come into the clinic, we don't just treat depression, we treat hopefully the underlying cause of what's causing the depression.
And we'll get into this more in the next segment for sure, but I just want to start. So how are these disorders then treated?
Well, we treat either with the needles and herbs. We can use just herbs or just the needles. And of course, there will be lifestyle recommendations that may come through as well.
And of course, in the Western paradigm would be more pharmacologically based or psychotherapy based, or a combination of the two things.
All right, and in the next segment, we're going to be discussing more about these treatment options, so stay with us.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. In this segment, we'll be discussing more about treatments. I'm with Dr. Wrench and Dr. Connell. So how successful are these treatments using both therapy and medications?
Well, in one recent study, it was found that pharmacologically based treatments have a much greater value, or we should say showed significant improvement over just psychotherapy.
So that's being prescribed medication of some kind, along with, and not just therapy or potentially counseling?
That's correct. There was a test group of 421 patients. 121 showed no improvement. 121 showed improvement. The 299 was very little improvement, if any. But the downside of pharmacologically based by themselves treatments or therapy-based is what happens a lot of times, to be fair, is that patients will discontinue. And it's true.
So maybe they'll only have a month's worth, and then
exactly. And you know, 2 in 5 Americans will not fill a prescription that's written for them due to cost. So a lot of times it's like, I need to take the meds, but the meds are very costly.
So there are a lot of factors that come into play of whether this treatment is continued.
Exactly, and it's hard to judge the efficacy when somebody starts a treatment plan, whether it's based on pharmaceuticals and or therapies, and they discontinue one, the other, or both.
Because then there's so many variables, you're not exactly sure what's potentially doing the most good.
And that's been the problem with therapy, is it gets expensive, and sometimes people go, well, I couldn't continue to go, or I felt better. But then there's always a problem of relapse.
So do you recommend one over the other, or does it just depend on the patient?
It actually depends on the patient and their physician. So that's something that would be worked out in the patient-physician relationships.
Now, is there a danger of relapse if these treatments discontinue?
There is a consequence of relapse, and it's statistically, it's I want to say it's within 6 months, there's a 75% likelihood of relapse.
Wow.
But this is in the wake of discontinuation of one or both therapies.
Like, okay, so completely stopping one of them.
Yeah, in other words, your physician prescribes this much. I want to see you this many times, and I want you to take these drugs for this period of time, and you opt out of that. So there's a 75% relapse.
So it sounds obvious, but how do you avoid this relapse? I guess you continue to get treatment.
You have to, and the good news is, and we'll talk about this probably in a moment, but there are options, and that a lot of people don't know, which is kind of why we're here today. So.
Exactly. And so when we talk about the traditional Oriental medicine approach, how does that differ in treatment from the Western approach, Dr. Connell?
Well, again, the Chinese medicine approach really addresses the underlying cause of the disease, right? So we don't just isolate the neurotransmitter and try and kind of fake out the biology to balance the neurotransmitter again. I would rather that I give the body the fuel it needs to make that neurotransmitter again. And again, we would intercede with the acupuncture and the herbal medicine, and again, lifestyle advice, which really for me is very key. Is getting someone to eat properly and digest their food properly. It's kind of grandma's medicine, but you are what you eat, and it will affect your mood. So this, in addition with the acupuncture and herbs, right, can help a person through the time when they start to discontinue the Western therapies.
And we hear a lot about exercise as part of staying healthy, but not always the case in some of these remedies. You don't necessarily have to be sweating it out in a gym. Is that right, Dr. Wrench?
Well, certainly everybody needs, we say the keys to health are rest, exercise, diet, and preventative medicine. Now, how you prescribe exercise for someone is almost an impossibility.
Right.
Depends on their age, what physical limitations they have, what they're willing to do.
Right.
And so on. So to say you need to go train at CrossFit and you need to become a jogger, and it really depends. Do human beings need to be active? Absolutely. We're not meant to be a sedentary species.
We're meant to be moving, at least somewhat.
Exactly. And a sedentary lifestyle doesn't lend itself to a long life.
So can acupuncture actually lower stress levels? And when we talk about stress and depression maybe going in hand, how does that work?
Well, absolutely, acupuncture lowers stress levels. It's actually one of the positive side benefits. It doesn't matter whether I'm treating elbow pain or depression or stress on its own. The acupuncture needles have a tendency to relax the person, right? Put them in what's called the relaxation response, or a meditative state. It will reduce cortisol levels. Stress is an overactive adrenal gland creating too much cortisol, and then it floods the system, and we're kind of then stressed out all the time, really hyper aware of what's going on in our environment. And the acupuncture can actually help take the cortisol out of the system and relax the person and show them again what it's like to relax. So stress relief is a huge benefit of acupuncture.
Mm-hmm.
There's a recent article in the Journal of Acupuncture and Meridian Science, an online article, and it talked about one simple 20-minute acupuncture treatment a week, if that were doable for any given individual, was shown to do just what Dr. Connell said, to lower cortisol levels, lower stress levels, to improve sleep, to improve memory, and to allow the patient to leave with an overall sense of well-being, unlike something they've experienced before.
And don't go away, because in our next segment we're going to continue this discussion about acupuncture as well as pharmaceuticals. Stay with us.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. We've been talking about a traditional Chinese medicine approach to treating depression and anxiety, and I want to go into this segment talking about emotions that could be tied to specific organs and their function on traditional Oriental medicine. How does that all work? Can you both explain that?
Well, I'll take a stab at it and have you chime in. It's a centuries-old concept of traditional Chinese medicine, that the body and the mind are an integrated whole, as opposed to the Western ideal of a disconnect between there's the mind over here and the body's over there. So the Chinese surmised 5,000 or 6,000 years ago that there's a direct correlation between an emotion and a specific organ in the body.
Oh, okay.
So in other words, like a tuning fork, it resonates with a certain organ. And when you say this to people for the first time, you kind of get that look like what you just got off the mothership. But we know this for a fact. In clinic, we see it all the time. When we have a particular emotion that we hold on to for a long period of time, it can affect the energy, if we will, what we call the chemical processes of a certain organ. And so and we link these to certain emotions we have, like fear, anger, worry, sadness, grief, etc.
Joy.
Joy, absolutely, which we would say is connected to the heart. Now, we can have a prolonged emotional experience that is not of a positive value for a long period of time, and we'll start to see something, whether it manifests in the heart in the way of, say, palpitations, or in the lung and a shortness of breath, or something will begin to show itself. And then we can also have an emotional upheaval that's like a spiking, but a short period of time, like a tremendous shock, a tremendous loss or something, which can ultimately have the same effect.
Dr. Connolly, you want to add to that?
Well, that situation he just described there is where acupuncture can be very helpful, right? We all experience emotional shocks in our life. It's part of being human. And we need help through those times. So not only can we look to our family, but we can go to our acupuncturist, and he can give us that moments of respite, which will kind of allow the emotion to easily move through the system. And we also see it a lot when people get overly angry. I think we've also all seen this, like the toxic emotion of anger, we always call it. The idea isn't to be anger, but to not hold on to it. And that emotion in particular can be damaging.
So have a valve to release it in some way?
Right, exactly. It's pretty much so it doesn't get stuck. It's not that the idea is to experience the emotion, let it move through you and process it, and then there the lesson is had. But when we hold on to it and we kind of resist what it's trying to teach us, then it can get stuck and then lead to further disease.
So in addition to acupuncture then, can herbal therapies play a role in the treatment of depression, anxiety as well?
Well, absolutely. Again, when we deal with the underlying cause, whether it be stagnation or deficiency, to keep it simple, the herbal medicine is very, very handy. Some of the Western herbs that people might recognize, like St. John's wort, can be used. It's not part of our apothecary, but we have, there's not really one depression herb, right? Right now I'm working with an herb, I'm just doing extra study about the herb Albizia, which is a Chinese herb called Hehuanhua, but it's also part of the Western apothecary. You know, it can be used to treat grief and depression. For us, it just helps the blood flow. So again, it's that idea of allowing that emotion to move through, and that will reduce the depression and anxiety.
And as an aside, too, the good thing to remember about herbs is that they're botanicals, they're minerals, they're things that are found in nature. And so they're not synthetic, so they're not read by the body as being foreign unto itself. So we rarely have side effects when they're properly prescribed. So we don't get the warnings and all the things on the label. So the good news is, if I'm taking a medication, and you know, all medicines are necessary, I don't care where they come from. But if I'm taking medication and the side effects are significant to me, I'm either going to ask for a variation of it, or my option is, the heck with this, I'm going to discontinue it. We rarely get that with the herbs, unless in the unlikely event it's a problem with absorption or indigestion. It can affect.
Could there be an allergy? I mean, we hear so much about.
There could be that, but generally we don't give an herb to somebody and say possible side effects include nausea, vomiting. We don't do that because it really isn't necessary.
And as far as these herbs, give the viewer a sense of how they're prepared. Typically, are they boiled? Do you drink? What happens?
We have 3 easy options. The easiest being just a patent medicine, so it's just made into a little pill for you, ready to go.
Okay.
The second would be powdered form. This is actually very effective because it's well concentrated, so it's a little more powerful than the patents, and you get a little bit of the taste, which I believe is therapeutic on its own. And then finally, yes, the raw sticks and berries and leaves, right, that the herb is actually made from in the different patents. Now, the raw herbs are significantly more powerful than the rest. It takes some dedication on the client's side to actually do the cooking of it. But we would want to do raw, but we sometimes, just per the patient, we end up doing the patent.
Now, if a patient comes to you for treatment of anxiety and depression, and they're already being prescribed pharmaceuticals from traditional medicine, perhaps, do you advise them to discontinue? What do you say?
I tell them to go talk to their doctor if they're curious about reducing their medications. It's not my purview to give them any advice about pharmaceuticals. So if they'd like any changes there, they have to go talk to their doctor. If they decide to go talk to their doctor and want some support during that time, we as acupuncturists can provide that support, particularly through the herbs.
All right, and in this final segment, we're going to cover how a patient goes about getting all these treatments. We'll be right back.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Welcome back. In this final segment, we'll cover how a patient goes about getting treatment along with a few other things. And Dr. Wrench, I understand the U.S. military uses something known as battlefield acupuncture for the relief of stress and pain. This sounds fascinating to me. Can you talk about that?
Sure, Grant, I'd be happy to. It's something that's been going on for a number of years. American military physicians, in conjunction with physicians from Germany, who's very big into auricular acupuncture, meaning treating the body by way of the ear. It's been around for centuries, but it's never been more in the forefront than it is right now. So the military has been using just what you said, battlefield acupuncture, and it's a very simple protocol, usually 5 or 6 little, look like little microscopic thumbtacks. Now in our clinic we would use needles, but we can also use these tacks, and they're placed at specific points on the ear. And just to be clear, the ear acts as a microcosm of the entire body. Every organ, every function, every facet of the body is located somewhere on the ear. Mm-hmm. And so it's where our neurovascular system is nearest to the surface, and it's also connected right here by our brain. So when we use it like a remote control for a TV, so right. It's very effective. So what they'll do is they'll treat certain points in the ear, and what's amazing is that the effectiveness of these treatments following trauma, following battlefield injuries. I
was going to say, is it based on somebody being injured, or can anybody receive this treatment?
Anybody can, and we actually do these at the college, but there's been shown to be an effectiveness in treating pain and stress, in some cases up to 70%.
That's fascinating. So how many treatments then, getting back to the college, would you recommend for someone coming to your clinic for anxiety or depression?
Well, that's hard to say. There is no one-size-fits-all in any medicine, really. But I think in our traditional Chinese medical approach, treatments are tailored and specifically for the patient, as they should be, depending on.
There would be a workup, a questionnaire.
Oh, certainly. And that's. Some protocols are simple, and it can be once a week for this. But for something like post-traumatic stress disorder, for pain syndromes and so on, it depends on the age of the patient, the severity of the problem, the longevity of the problem, again, lifestyle, all these things, diet, factor.
So Dr. Connell, give us an example for a patient, maybe a patient recently you've seen. Is this something that a patient could maybe be there for 3 months or more or less?
Well, my general recommendation, and again, this really is patient dependent, is 6 to 10 treatments, right? So I want 6 treatments minimum in most cases.
And those are weekly, or would that be
and that
a couple
depends,
every other day?
Let's just say a typical would be twice a week for the first 2 weeks. Okay. There's 4. And then give me once a week for the next 2 weeks. That's 1 month of treatment. I got 6 treatments in. They may be totally fixed after these 6 treatments, but after those 6, I'm going to make an evaluation and see if an additional 4 are needed and what the frequency is, right? And if you go through that amount of treatment in a 1 to 2 month period, we should be able to make a significant difference in your anxiety, your stress levels, the pains that you've been feeling, right? And if we haven't made a significant difference, we may need to refer you out.
And we've been kind of talking about anxiety and depression going hand in hand, but either one of these, someone could have one and not the other potentially, right?
Oh yeah, easily. Most of the times we see them hand in hand, but some chronic depressed people just have depression, and then acute anxiety people usually just have anxiety. So those are some generalities, but they can come hand in hand or one just on their own.
There's a 50% likelihood if you have one, you'll have the other.
So gentlemen, we only have a few seconds left. How do potential patients go about scheduling an appointment in your clinic?
Well, that's the easy part. You can look us up online, or you can call 941, of course, 355-9080. Ask for the clinic desk, book your appointment, and we'll
And
take
you can
it from
stop
there.
up there, and you guys are located right up on North Tamiami Trail in Sarasota.
That's correct, we are.
All right, thanks for watching Local Doctors on Call. We'll see you next time.